Hi everybody, welcome to Introduction to Medical Terminology. This unit focuses on different types of medical words. It also will help you break down those words into different parts. It's going to be really important for you going forward to know what medical terms mean. And there's no way for us to know all the medical terms in the world if we were just to pull out a dictionary. But what we can do is break the word into its word parts in order to figure out that definition. So medical terminology is truly learning a different language. So please give yourself some grace, be patient with yourself, and spend a lot of time going over these medical terms. Again, they're not going anywhere if you're planning on staying in the medical field, so you need to be very familiar with these words. I suggest flashcards, Quizlets, repetition, repetition, repetition. It is going to be a true memory game. So this course or module, will focus on introducing medical terminology and how to break up those words into different word parts in order to figure out the meaning of that medical word. So our learning objectives for this lecture is to understand the importance of medical terminology, learn the basic structure of medical terms, explore common prefixes, suffixes, and root words, and then apply knowledge to decipher medical terms. So why learn medical terminology? Well, for one, it is the universal language in healthcare. And as stated before, it truly is another language. So it's going to take some time to memorize the different meanings of the word parts. It also will help enhance communication between professionals. This is how professionals communicate with one another when they are explaining a specific medical term. It also helps improve patient care and safety, and that is done by simply saying appendectomy. Well, between healthcare professionals, everybody knows what an appendectomy is. But if I were to say we're going to remove that one part that's not really truly doesn't have a real function that we've discovered yet, that's pretty vague and it doesn't really help clear up what exactly we're removing from the patient. So it helps improve patient care and safety by being very specific to what the procedure is or what the condition is. It's also critical for documentation and coding. Okay, so the anatomy of a medical term. Well, a medical term in general is going to have a couple of different features. The first is the root word. That is the core meaning of the term. Your medical term will always, always, always have a root word. The prefix is what is found before the root word. So it modifies the root word and gives additional meaning to the root word. It is found pre, which means before, the root word. Now, not all medical terms will have a prefix. They will always have a root word, they will always have a suffix, but they will not always have a prefix. Keep that in mind, that's important to note. Suffix indicates the procedure, condition, disorder, or disease, so it also helps modify that root word, and the suffix is found at the end of the root word. So again, you will always have a root word. It tells you the meaning of the term, and then the suffix is found at the end. You will always have a suffix as well. Last but not least is the combining vowel, and the vowel is what links that root word to the suffix or another root word. So if there's a medical term with two root words, you will have a combining vowel. Now, combining vowels are usually an O, unless that root word to follow or the suffix already starts with a vowel, and then it will just be the vowel that next word starts with. Otherwise, more times than not, you're going to see that combining vowel as an O. The combining vowel helps with ease of pronunciation. That is the only reason for the combining vowel. It doesn't modify the term whatsoever. It's just for ease of pronunciation. The next couple of slides are going to give common types of medical terms. So this slide focuses on common root words. Now these are, again, the meaning of the actual medical term. So some examples here, cardio, cardi is the root word, slash, backslash O, that is your combining vowel. So cardi, cardio, means heart. We've probably heard that in different forms, but that's one of the easier ones to remember because we hear it more often. So cardio is cardi is the root word for heart. Next up we have gastro, which is stomach. So gast, backslash with the O, means stomach. Again, the O is the combining vowel. Gastro or gast is the actual root word. We have neuro, which is nerve. And then hemato, which is blood. So those are a few common root words. You're going to learn many, many, many different types of root words when we talk about different types of anatomy and those specific types of body systems. All right, next up is the prefix. Now the prefix again is found at the beginning of the root word. So some examples here are hyper, which means above and excessive, which if we think in general terms of what we know hyper to mean, it means the same thing here. We have hypo, which means below or deficient. Another type of prefix is brady, which means slow, and tachy, which means fast. So hyper is above, think of, hyperactivity, somebody is hyper, they are above, they are excessive. The opposite of that is hypo, which means below or deficient. And again, these are prefixes found at the beginning of those root words. Then you have Brady, which is slow. If you are a football fan, if you know who Tom Brady is, he was a quarterback. However, he was known for also being very slow. So one fun way that I remember Brady is slow is to think of, all the references to Tom Brady being slow. Tachy is fast, which in this case, let's say we use tachycardia. Tachy is going to mean fast. Cardia is heart. IA is a condition of. That's your suffix. So tachy is fast, and that would be a fast heart rate. Okay, so some common suffixes. Again, suffix is at the end of that root word. We have itis, which means inflammation. So if you've ever heard the term arthritis, that means inflammation of the joint. Arthur means joint. Ectomy is surgical removal. Ology is the study of, and pathy is disease. So if you notice on ectomy, ology, pathy, itis should have one as well. The little dash before it, that means there's a word that usually comes before it. So your root word would be found there, and these are all suffixes. Okay, so a little bit more in depth about those combining forms. So it's usually the O, remember the vowel, the combining vowel? It is usually an O. And again, it is just for ease of pronunciation. It doesn't add or take away from the root word. So we have an example here, gastroenteritis. And if we break it up into the different medical terms, we have itis at the very end, that's our suffix, that means inflammation. Enter is a root word, and it means intestines. We have the O, which is a combining vowel, and gastro, remember means stomach. So gastroenteritis refers to inflammation of the stomach and intestines. Now, if I were just to look at that word without knowing those different medical terms, could I figure out what it meant? Probably not. But if I break it up into the different medical terms, then it's much easier to decipher. So once again, we've got gast, that is your stomach root word. You need a combining vowel, your O. Enter is intestines, and then itis is inflammation. So inflammation of the stomach and intestines. You will also notice in this word we do not have a prefix, and that's okay. Not all medical terms will have a prefix, but they will always have a root word and a suffix. So let's break down the following terms. We're going to give some of these terms, we're going to be able to decipher what they mean. So the first one is cardiomyopathy. So as we know, cardi means heart. Myo, we haven't gone over this one yet, but could be muscle or the middle. And then pathy is disease. So again, we've got cardiomyopathy, which means disease of the middle muscle of the heart. Next up, we have gastroenterology, which is a little different from the term we already discussed, but gastro means stomach. Enter is intestines, and ology is the study of. So gastroenterology is the study of the stomach and the intestines. Last but not least is neuropathy. That is neuro. Neuro is our root word, and it means nerve. And pathy is referring to disease. So disease of the nerve or the nervous system. So upon just looking at these words, we might not know exactly what they mean or refer to. But if we start to break them up into different medical terms, it's much easier for us to decipher what the words mean. So again, it is memorization, it is being familiar with these words and these terms, and it takes lots of practice.